literally, this is something which not many people have heard about. I heard about this condition for the first time, AVN. So please explain all our listeners, what exactly is this AVN, and what is this condition and how did you deal with this?
I'll just take a slightly extra minute, because I had never heard of AVN, and I used to be a regular guy doing gymming. And slowly but surely, my right thigh started paining when I used to do weights and all. And it just kept on increasing. And I kept on doing normal stuff, did not really work. I got an X-ray done, and the X-ray showed nothing. So I went to a doctor. He said, "Tum ye painkiller kha lo, do these physiotherapy sessions and sab theek ho jayega." After 2 months, he said, "Abhijit, there's something wrong. You're perfectly fine. I think it's psychological." And I was 34, 35 at that time. So तुमको stress बहुत है, मुझे लगता है तुमको pain है ही नहीं. Why don't you be a psychiatrist? And he actually made me go to a psychiatrist. The psychiatrist gave me some tablets which I took for exactly 1 day. And I realized that my mouth is drying and I'm going very slowly. And I was in Noida, I remember. I just threw the tablets away. And I just ignored him, but the pain came back. So luckily, I found some other doctor who told me to do a 3D MRI. So to do a 3D MRI, this was found out. So basically what happens is that in your thigh, there's a bone, a femur bone, which is a very big bone, and it is covered like this, and this just breaks away. So avascular necrosis is stopping of the blood supply to a bone and the death of a bone. So this bone becomes like chalk, like very soft kind of, or like cheese, and that leads to massive pain. So once this 3D MRI came out, and I even that MRI guy himself told me, "Arey, abhi to aapko operation karna padega, replacement, hip replacement ka." So I got psyched. So then luckily that Dr. Shetty guided me to Dr. Sanjay Agarwala, who is the head of department in Hinduja. He's a rock star, and I've been meeting him from 2008. My son was yet to be born, so 2008. And I was in excruciating pain. I just could not even put my foot down. And whosoever I met, they said, "Tumko to abhi hip replacement surgery karna hi padega." And at 35, it's very young. Normally, people above 50 used to get that. So when I met him, he saw me, and then we had a discussion, and we just had a connection. And he said, "Ki dekho, aisa hai, I do surgeries. That's my occupation, my profession. I get paid for that. But I will not do your surgery till I am 50 years old, till he is 50 years old." And that's how we started. Then he started me on a therapy called biphosphonate therapy, which really worked on me. And slowly but surely, my pain went away, and I started going back to walking and to gymming. And it's quite surprising, because now he calls me his ideal patient. But when we now look at year after year of my X-rays, that bone Vishal is actually filling up, which is not something that normally happens. So you must have heard of the story of the bumblebee, where they say that the bumblebee physically can't fly because the body is too heavy and the wings are too weak. But
as per the laws of physics, it's not supposed to fly.
Yeah, but the bumblebee doesn't know it, so the bumblebee keeps on flying. So when I met Dr. Agarwala, I had AVN stage between 2 and 3. It went to 3, and now it's 4, and it is the final stage of AVN, which means the breakdown. Wow. So as per my X-rays, and touch wood, as per my X-rays, I can't walk. But I do, and I do walking. I don't do running, but
you've just done 30,000 steps a day. Clearly, that report is not true.